I'll let you know when it starts. Okay, you're good to go.
Hello, everybody. Welcome to our January Board of Health meeting on this snowy day. So hope that everybody is doing well and is somewhere safe and warm. We have quite a bit on the agenda today, so we'll go ahead and get started. But before we get into the official part of the agenda, I did want to welcome Samara, who is our new board member. And so Samara, could you take just a second and introduce yourself to everybody?
Sure. Hi, I'm Samara Touchton. I'm a nurse practitioner. I work at Cayuga Medical Center with the hospital medicine group, and I also work at Reach Medical as a primary care provider and addiction medicine specialist.
Great, thanks, Samara. And can we just do a quick round robin just so Samara is aware of who everybody is on the phone or on the Zoom call? Let's start with Liz. I'll work backwards here on my screen.
Hi, I am Liz Cameron. I'm the Director of Environmental Health for Tompkins County.
Great, thanks. Sam?
Hi, I'm Sam Hilson. I work as Director of Health Promotion at the Health Department and Public Information Officer. Nice to meet you.
Hi, I'm going to do staff first. Claire?
Hi, I'm Claire Espy, Community Health Director at the Tompkins County Health Department. Nice to meet you.
Dr. Claypack?
Thank you, and good. Welcome to the board. I'm medical director at the department. I've been medical director for quite a long time, since the 90s. And I'd welcome a conversation with you about my role and how I do it and what our typical problems are that we run into, particularly in non-COVID times, because most of our work now is, of course, related to COVID. But there are many, many other issues, including things that REACH is interested in, that the department has been active in. So I'd be more than glad to speak with you directly over the phone or in any other way. If you wish to give a call to the department and ask for my secretary, Abby, she could set up a time that we could speak together.
Great, thank you. Deb?
Welcome, Samara. I'm Debbie Thomas. I'm the Director of Children with Special Care Needs here at the Health Department.
Okay, great, thanks. Jonathan?
Good morning. I'm Jonathan Wood. I'm the county attorney. I have the same message as Dr. Claypack. I've been the attorney for the health department more than 28 years now. If you have any questions, feel free to call us at the county attorney's office or email us. Be happy to share anything that would be helpful.
Okay, great, thanks. And Karen?
I'm the administrative assistant, and I send you all the notices and for the agenda and the minutes. So call me if you need me.
Okay, great, thank you. And Frank?
Hi, Samara. Frank Krupa, Public Health Director and Mental Health Commissioner. And I'm going to ask Karen to set up a time where we can do a board orientation with you in the next couple of weeks so we can answer questions and you know, get you connected to all the right people and help you feel comfortable serving on the board. Thank you for joining us.
Okay, great, thank you. And now just quickly, our board members, let's see, I'll start with Dr. Dundaly.
Hi, Samara. We know each other.
Okay. Then Shauna.
Hey, Samara. Shauna Black, Vice Chair of the Legislature. Nice to have you.
And Sue.
Hi, Samara. Sue Merkel. I teach microbiology and public health microbiology at Cornell and am a member of the Board of Health for, I don't know, a bunch of years.
And the other Dr. K.
Hi, Samara. I'm Ed Kopel. I'm a physician at Cornell Health, and I'm assistant medical director here. And I've been doing this for a long time here. Well, Board of Health for a little bit, and in this position for about 20 years.
Great, thanks. And Dr. Evelyn.
Hi, Samara. We know each other.
I just don't know who knows who, so I don't want to leave anybody out. And welcome from me. I'm Christina Moylan. I work at Ithaca College, and then have been on the Board of Health now for 2 to 3 years, 3 years probably. So have really enjoyed this opportunity. So welcome, and we're so happy to have you as an additional voice on the board. Okay, thanks for the introductions. I hope I didn't miss anybody. I think I got everybody, but if I didn't, somebody speak up. Okay. Frank, do we have anyone for privilege of the floor?
No, the wards are not in the waiting room.
Okay, great. So let's go ahead and move on. The next item on the agenda is approval of our December minutes. So could we have a motion and a second on that? Okay, I've got a first from Sue and a second from Melissa. Any discussion on those? Changes, edits? Okay, all in favor as written? Anyone opposed? And any abstentions? We got an abstention from David E. Okay. Next up on the agenda is our financial summary. Frank, are you going to, did we lose Frank, or he shifted spaces on my, oh, he went quiet.
I'm here. I'm sorry. I had to take a quick phone call.
That's
Apparently
okay.
there's a rumor going around that I died of COVID and people are trying to make sure I'm not dead.
Are you serious?
Yeah.
Oh my
Just
goodness.
sneak away, Frank, to some island somewhere.
Yeah.
Oh, well, I'm glad you're still with us. So
I am.
can you provide us with a financial summary? Please.
No.
Okay.
Did it make
It's
it
in
into
your board
the
packet?
It's
Yeah.
as long, it should be in the packet. You know, we're doing end of year stuff from last year, which is, you know, just extremely, it's different, obviously, with the way last year went. Most of the county expenses for COVID are being worked through the health department budget. So there's a lot of moving pieces, including with the testing, the testing funding. So it's going to take Karen and Brenda when she returns a little while to kind of get all that straightened out. But you know, we're okay. We made the budget changes we needed to last year, you know, mid-year with the reductions. We're obviously looking to the state to see what's going to happen with their funding moving forward. I think one bit of good news we heard was if the federal government, if $6 billion comes to the state from the federal government, the withholds that have been 20% should go down to 5%. Which means some funding that we didn't receive last year, we would then receive, and hopefully that means fewer reductions this year as well. So we're keeping a close eye on the state budget to see how that unfolds.
Okay, questions on finances? Okay, Frank, I'll keep you on screen then. Do you have any administrative updates that you wanted to provide?
Yeah, just wanted to kind of talk a bit about COVID and where we are. Starting with the disease, we definitely saw an uptick from the holiday season, you know, right around the 2-week mark from, you know, each of the events, Thanksgiving, then rolling into Christmas, Hanukkah, and Kwanzaa, and then New Year's. The numbers went up. The last few days have actually been fairly promising. So looking at the statewide numbers, ours are kind of tracking along that perhaps we might have hit that holiday peak and are heading back in a more favorable direction. We do have the students returning. Cornell had a significant move-in this past weekend. Ithaca College is beginning their move-in processes. So the students are returning for the spring semester. And so there is re-entry testing occurring. We are finding cases, which is good. It's not good that they're cases, but it's good that we're finding them quickly and getting them isolated. So there's limited additional exposures. So I think so far that has gone well. We did, with Cornell's help, identify a UK variant here locally. The Cornell laboratory has the ability to do the genome sequencing, and so our staff are alerting the lab when we have someone that has international travel that's a case and or is a close contact of somebody that had international travel, so we can get those checked. So we'll likely know probably sooner than most communities if we have variants, because we have that local capacity here through Cornell. It doesn't change what we do with the case. New York State doesn't have any additional guidance around the variants at this point. But it's certainly important for us to know, because we definitely want to get our arms around those, particularly if they are, they end up being more contagious and or having the vaccines be not as effective on them. So still a lot to learn about those, but we did want you to know that, there is some local capacity to try to identify if we have the variants. Vaccinations, the big thing now, everyone wants to know when and how they're getting vaccinated. So we were extremely fortunate at the beginning, I guess at the beginning of January, that we received large allocations of vaccine. And the main reason for that is CHS, in partnership with the county, was able to stand up a large scale site before everyone else. And so there was vaccine to be given at that point. And so we vaccinated over a 2-week period, almost 5,000 people, which at the time was more than really was happening anywhere else. Things have caught up. The state has now created their statewide sites that I think everybody is aware of. There's one in Binghamton and one in Syracuse. I believe those are the 2 closest to us. But the state has not received a larger allocation from the federal government. So as those large scale sites opened up and the state opened its distribution system to include pharmacies, the same amount of vaccine statewide was available and had to be divvied up amongst all of these other distributors. So that means that our allocation has gone down. Last week we didn't get any vaccine. And today, this week, we are getting some, but a much smaller allocation. We got 600 doses. The state sites are taking anyone that is eligible currently, right? So all 1A and 1B, anyone that fits those categories can go to a state site. Unfortunately, they're booked out months into the future. But they are the only location that takes anyone that's currently eligible. The state has set up criteria to kind of divvy up the rest of the groups amongst the hospitals, the pharmacies, and health departments. The hospitals have been directed to focus on healthcare workers, still remaining from phase 1A. Pharmacies have been required to focus on 65 plus. And health departments, local health departments, are required to focus on essential workers. So that doesn't really fit the model that we had been doing, right? Because we had essentially opened our own large scale site, similar to what the state is now doing. We were doing anyone that was eligible in the current criteria. Because we're getting fewer doses and the state has told us essentially we can't do that, we are trying a different model this week and prioritizing some populations within that. It's not easy to prioritize who gets vaccine. Let's be clear. I would argue that the federal government and the state punted and didn't decide who was going to be eligible, and they opened it up to large quantities of people with not nearly enough vaccine availability for it, which created chaos around scheduling appointments. I think we all witnessed that last week, particularly when the state sites opened. So in an effort to not replicate the chaos, we are trying to take a more measured approach to this. And so with these 600 doses this week, we are prioritizing first responders, corrections workers, and P through 12. All right, so we're using the people that are in, yeah, you applaud, Dr. Dondali. I can show you the emails and phone calls of the people cussing at me now. But it's, so that's where we're starting. I felt like it was necessary for us to prioritize because it is only 600 doses and there's no sense in having the whole community clicking away on their computer fruitlessly not getting appointments. So these were difficult decisions, and obviously we can't get to everybody. We don't even have enough vaccine for everyone in those categories, right? So we're doing a phased approach, and links are going to be sent out through employers over the next day or two to allow those folks to get registered for this week's allocation. We'll review after this week how it goes and how many people we got in those groups, and then we'll make decisions for next week's allocation on what populations we will prioritize. But again, it's never easy to tell someone they're not getting the vaccine, but we felt that it made more sense to make those hard decisions and limit the people eligible, just so everyone is not spending their time trying to get an appointment fruitlessly. So that's kind of where we are with the vaccine. I can tell you that we are advocating extremely hard to the state that we can do more. And we've demonstrated we can do more. Through the hospital's support, we have offered to be a state site. We feel like we can do the same throughput, if not more, than they are doing at the Binghamton site. So we continue to advocate for more vaccine for our community. But that's kind of where we are from a vaccine perspective. And then the last thing I wanted to mention was high-risk sports. So this is another one that's slid down to us to decide on. The governor has said that high-risk sports can begin if the local health department authorizes it. They gave 3 broad categories on what we're supposed to consider. It includes, having the variants being widespread in our communities, infection rates, and ability to do enforcement. So those are kind of the 3 baskets. Since that came out Friday afternoon, we've been working with NYSHO, with our colleagues in the region. Liz and Skip have been working diligently on looking at the guidance and trying to figure out where we're going to go with it. I have a meeting this afternoon with the superintendents to kind of get their input and feedback into it, and then ultimately we'll make a determination on whether we're going to authorize or not. I can tell you that right now we are likely to authorize it. I think the governor's directive has pretty much said, unless we have a really good reason that we're different than everywhere else, we need to. But we need to figure out what are the appropriate controls we want to have in place to move forward with that. So again, difficult decisions to work through, but we're taking all the appropriate steps to gather as much information as we can to move forward with that. I can tell you I've gotten more email about reopening sports in the last 3 or 4 days than I have on any other subject for the last year. So there's definitely interest in this. And we want to do what's right by our kids and do it safely and hopefully get back to doing some of the things we haven't done in a while, if we can assure ourselves that we're doing it as safely as possible. So those were the 3 things I wanted to update you guys on. I'm happy to take any questions.
Hey, questions, Sue?
Yeah, Frank, you mentioned that the health department was focusing on essential workers and the hospitals on healthcare workers, but in this county, is that the same thing? Like we only have one entity who is doing vaccination, or is that not true?
No, so I should say the allotments are allocated that way. So we are very closely partnered with the hospital. In fact, our allocation we had shipped directly to them because their pharmacy is more equipped to receive large amounts of vaccine, and they have professionals that do this all the time. So we are very much linked and partnered with Dr. Evelyn and the folks at CHS. What matters is who the allocation was allocated to, right? So these 600 doses that we got this week were allocated to the local health department, and we're partnering with CMC to administer them to the priority population that we've been assigned. If the hospital were to have gotten their own doses, then we would be talking about how do we do, the essential workers as well as the folks that they are required to prioritize. The hospital did not get doses this week, so that we don't have any additional beyond the essential workers in 1B. And our local pharmacies, as we understand it, are getting vaccine. We don't have information about how much or how many people they vaccinated. The state has been unable to provide that to date. So we do know that there is some 65 plus vaccination going on, but we don't know the full extent of it.
Great, thanks. Other questions? Ed?
Yeah, does this decision about sports also affect the universities in town?
I think professional and college sports have their own guidance that they're supposed to be following. So I want to say no, but don't hold me to that just yet.
The only reason why I mentioned that is because my understanding was that that college sports had to abide by local public health directives as well. That's all.
Yeah, and if there's anything we need to work through, then we of course will. Liz, you can correct me if I'm wrong. I think the colleges and professionals have their own guidance.
I'll look into that. Professional sports training. I'm gonna have to look into.
So we have three colleges in town. So
yeah, there's a separate set of guidance, and they're using the same kind of risk categories that I think is described for the K-12 situation. So I think we just need to be careful that as you're making decisions that you're thinking about consistency across everybody. And that if we need to be thinking about something differently at the higher ed institution level, that we're made aware.
Yeah, definitely.
We also have to have our plans approved by you. So I think we just need to, you all just need to make sure that it's consistent. Or if it's different, there's a reason that it's different.
So this guidance does not apply to collegiate sports, the youth, the recreational sports doesn't. I'll have to see what the specific guidance is for those to know if there's any differences.
Okay.
Cornell has to abide by the Ivy League rules too. I don't think it can make decisions independently.
Right. Well, and then there's the NCAA as well. So I think there's some overlapping.
Yeah, and I think one thing to make note of too, as some of the counties around us are considering only doing this for K through 12. And I think we're pretty close to a final decision that we're not, it's by activity and it's recreational sports. So if you're doing that activity, whether it's K through 12 or a private club, they would still be able to do it under the.
So this is not competitive sports in high schools and
it is.
It is.
It is. Those are considered recreational sports.
Okay. And just for interesting piece of information, I saw an email just go by my screen as we were talking from one of our local EMS chapters here in the county that said, better get your vaccination. There's only 4 more spots left. So they might be going really fast.
Did you say 40 or 4?
44.
Yeah, no, that's actually really good. So we're that's good that there's slots still out because they've been open now for almost 3 hours. So that means it's a more controlled, it's getting to the people that are eligible, and it's not gone in 10 or 15 minutes. The 1,800 slots that we put on 2 weeks ago, I guess it is now, were gone in 20 minutes.
Yeah.
They were gone. So, but we're trying to take this more reasoned approach to make sure the people that are eligible and being prioritized have access. And so the fact that we've made it a couple of hours means that at least so far that's working. And please understand that that's not all of the slots. We're doing certain groups in order. because we wanted to make sure that if the link got out, it didn't eat up all 600 slots. So there will be more slots released as we move to the next groups later today and tomorrow. It's just for the groups that have the link right now, there's still slots available. For the folks that have not yet gotten the link, there will be more slots put in later today or tomorrow morning. We're trying to coordinate it so it goes smoothly and people can actually get appointments when they get notified. So keep your fingers crossed for us.
Great. That sounds wonderful.
Thank you. Okay, any other questions or comments for Frank? Okay, Claire, you're up.
Hey, everyone. I don't have any specific details to add to the report. If there are any questions, I'm happy to answer them. I think there's some overlap in what Frank described in terms of the COVID surveillance work that we're doing. But
Okay, thanks, Claire. Any questions or comments for Claire? Okay, Dr. Claypack, you're up next.
Thank you. Good afternoon again. Well, there's a little advertisement where the department is hiring. This was in the Tompkins Weekly. So if you all know people who are looking for a job in nursing or in contact tracing, the department's hiring, both some permanent and some temporary. So I thought it'd be useful to get the word out on this kind of a meeting. In terms of vaccine availability, I would only add a couple of points. I've become aware of people who have gone to other counties to get vaccinated. Obviously, other counties will be subject to the New York State guidance in terms of this vaccine rollout this week, but people do travel. And since that would go for essential workers as well, people covered under the current restrictions, it's not limited county by county. You can cross county lines, and people do it. And in fact, I know of people who have gone down to Sarah, Pennsylvania, and become vaccinated at Guthrie's vaccination site in Sarah, Pennsylvania. There are about 4 or 5 counties in the southern tier that they will register to receive a vaccine. I believe you need to be registered in the Guthrie system, which means that you've probably seen a Guthrie practitioner or you've had some testing or some other thing that got you registered. But those seem to be the only criteria for being able to access that Pennsylvania vaccine. There was one other point I think I wanted to make. I guess I would just compliment the medical center and CHS for their efforts on this vaccine effort. Can you imagine how difficult it is for a private entity to try to stand up a vaccine clinic when things change week to week, if not day to day, as they are, to have it staffed, to commit to your employees, et cetera. It's no small deal. Even what they've done already is, of course, we've all been complimenting them for. It's been remarkable. But this latest turnaround with the spigot turning on and off makes it even more dramatic. I have a screen to share. Would it be all right if I shared my screen and showed you a graphic?
Yes, someone's going to have to give you permission if it's blocked. So whoever is the meeting host. There you
Does
go.
that show up?
Yeah, it did.
Oh, good. This came out of an MIT study looking at people accepting vaccination. And this, of course, is our greatest challenge for the coming 3, 4, 5 months, is to make sure we get to community immunity by getting a high enough percentage of persons vaccinated. So they have on the website for this graphic, the entire United States. I'm showing you just obviously our upstate region. And you can see up here the graphic between 50% chance and very likely. And here's Tompkins County. just as we would expect, being our island of reality surrounded by everybody who will catch up sometime. I say that in jest, of course, but people at Tompkins County are calculated to be at 85, almost 86% accepting a vaccine. That gets us above the threshold. But as we look around our region, we see that we're surrounded by counties that are in the upper 60s into the 70s. And these are only people who are saying that at this time that they would be likely to get vaccinated. Will they actually follow through? That's another story, as we all know. And as we see these roadblocks come up where we don't have enough vaccine, people can't get it, act on the availability right at the first point of care, that, as we all know, drops our rates. We can see down here some counties that are lower, and then pretty much we stand out in our region as being up amongst the highest. I think the message here is that for public health, it helps us to target where we need to have our message be voiced the strongest by knowing where the rates are lowest. And as we all know, scientific data does not necessarily sway a person's mind. It really needs to be somehow an emotional appeal to some degree, but it also, one of the important points are for practitioners and people in healthcare to not be afraid to stand up and say, I got vaccinated, this is why I feel good about it, and lead by example and lead by influence. So I thought this might be interested to show you. I'll stop sharing and ask if there are any questions.
Any questions or comments? Okay. Sam, thank you very much, Dr. Craigpack, for that. Sam, I'm going to come back around to you regarding health promotion.
Okay, sorry, I thought you were saying you were coming back to me.
No, I put Claire ahead of you just because I knew her report was really similar to Frank's, and so I'm just and Dr. Claypack's as well. So now, just to shift gears a little bit, I wanted to come to you. Okay.
Thanks. So nothing to add to my report. We are sending out a postcard to, oh, there we go, cue Frank, to all residents and businesses in the county. It has some basic information about getting the vaccine and a note about mental health and making sure that we're paying attention to that as well. So that is going to the printer, I believe. So hopefully you'll all get it within the next week or so. That's it right now.
Great, thanks, Sam. Any questions about that or comments about that for Sam? Okay. All right, Deb, I think you're up next.
Hi, everyone. Just want to say that Children with Special Care Needs Division is getting back to a little more of our own work in early intervention. Very happily doing that. Thanks to all the county offices providing help with the COVID response, we've been able to do that. We still are jumping in midday if it's needed when we have some higher numbers with case investigation. And that's all I wanted to add to my report.
Okay, great, thank you. Any questions or comments for Deb? Okay, Jonathan?
Yeah, I don't have a report.
Okay, great, thank you. And then for the CSB report, Frank, are you doing that, or did we have somebody attend?
We did not. And one of the things that I was talking, Christina, we need to get with you. I talked with Mary Hutchins, and we're thinking about doing a joint meeting to kind of launch the strategic plan.
Okay.
For everyone. So we're working on that, and I think part of that meeting will be to launch the strategic plan, and then also talk a little bit about how the two boards want to interact moving forward. I think we did the person going for a little while, and that lost a bit of steam. And I think Mary voiced that she really wants it to be some substantive crossover, right?
Mhm.
Versus just, reporting out about what's happening at the other place. So
Right.
we're looking forward to setting up that meeting in the next month or so.
Okay.
And then hopefully we can have some conversation about, what this will look like moving forward.
Okay, that sounds great. Any questions or comments on that from anybody? All right, Liz, environmental health.
So we've been, we were assisting when the vaccine first started going out. Those calls went to EH. My staff probably regretted that I volunteered us to handle those initially. It was rather overwhelming, but thanks to a group effort, those were now in the process of, those are transferring voice messages to 211, which I think is going really well. And we've also been assisting community health services with some of the calls that come in regarding quarantine and isolation for people that may not have been contacted or didn't get their letters or something. And we're also in the process of trying to get other people trained to do that, so that we are also looking forward to getting back to doing our core environmental health work with, of course, the COVID spice thrown in for other activities that will remain with us for, I would expect, 6 months or longer. I think that's all I have. We're expecting a huge volume. We're already starting to get some inquiries on the youth sports. So that'll be one of our EH COVID activities that'll be taking the place of some of our freer time. That's all I have.
Okay, great. Any questions for Liz? Otherwise, I'm gonna keep her on the screen here for the next section. Okay. So everyone should see in their email, this came separately this morning, the request for the waiver. It was on the agenda, but we didn't have the actual materials. Does everyone have those? I just want to make sure before. Okay, perfect. So before we put this under formal vote and discussion, Liz, can you just give us the general background, and then I'll put it under a motion?
Yes, so this is, oops, sorry, I'm on the wrong thing. This was a residence where they had a failed on-site sewage system, and they're having some economic issues related to the pandemic, and so they have requested to have the permit fee waived to help with them since they need to replace their sewage system at this time.
Okay, great. Thanks for that overview. So does someone want to put a motion on the floor to approve as written? Okay, I have a first from Shauna and a second from Ed. So let's open it up for discussion. Shauna?
Yeah, I'm actually, I'm not glad that people have to do this, but I am glad that we have the ability to waive. So I am definitely in favor of this.
Okay, great. Other thoughts? Comments? Okay, are we all ready to vote? All in favor as written? All opposed? And any abstentions? I think that was unanimous. Okay. And I think that is the end of our meeting, unless, Frank, there's anything else that's come up in the last couple of minutes that needs to get added.
There isn't. I would just want to, offer to the board that the team at the health department is doing some pretty amazing things, and folks are continually thanking me, and I don't know that gets down to them often enough. It truly is remarkable. We are in the position that we are because of all of the work that they've done. The people that you see on this call have put in uncountable hours trying to protect and provide information for the community, and then they're supported by teams that have put in additional uncountable hours to respond to all of this. And then you couple that with our partnership with Cuyahoga Health Systems, and this is just a pretty amazing place to be. And I just wanted to make sure that we, had a chance to acknowledge that, and as a board here, that the people that work for you are doing an amazing job, and our community partners, as always, are stepping up. So I thank everyone, and I'm looking forward to hopefully 6 months away, as Liz said, we can get back to normal, but we'll keep working until we are. Thank you.
Yes, thank you. And thanks to everybody that we don't get to see on these meetings. And we're obviously thinking about all of you and everybody that we don't get to see, and completely recognize the hard work. And especially, I think, when we talk to colleagues around the country, or even friends and family around the country, and realize what we have in Tompkins County is so unique. And it's always interesting too, bringing students back into an environment that is clearly completely different than what they're experiencing at home, in terms of what's available with respect to testing, the fact that we can vaccinate people, the expectations, the behavioral expectations. I mean, it really is just amazing, the support, I think, from across the community. So I'm assuming I'm speaking on behalf of all the board when we do say thank you to everybody at the health department, Cuyahoga Health System, and all of you on the board who have other jobs aside from this, where nobody escapes from COVID. And I think it's part of everybody's position right now to work with the health department informally, or Cuyahoga Health System in a different capacity than aside from just on this board. So it's a great place to be. And a great place to be involved in public health. So, okay, with that positive note, anything else from the board? All right, so we'll go ahead and adjourn. Sue, are you saying bye, or did we raise your hand? Okay, yeah, so that's a favor. Everyone in favor of adjourning? Yes, yes, goodbye, everybody. And we'll see everybody next month, okay?
All right.
Bye-bye.
Bye.